In 2015, the jewelry company Pandora did a promotional video for a new charm bracelet. The producers broke the video up into 4 parts: a graphically attractive text introduction, a heartwarming video clip, a cute outro message, and the reason why you should buy this revolutionary charm bracelet. The hook they used was to show the bond between mother and child. 6 mothers stood in a line, and their blindfolded young children tried to figure out which one was their mom by their hugs. Even though it was obviously played up to advertise a product, when people watched the video, they just knew the feeling. There isn't really one word to describe it, but no matter how old most of us are, we know what our mother's hug feels like, and our mothers know what our hug feels like. For transnational mothers, remembering that feeling is what they can clutch onto as they think of their children countries away. I'm going to tell you the story that affects millions of families across national lines. A story that most people in the US don't even know is out there. That story is of transnational motherhood, or rather, the mental health of Central American transnational mothers living in the US. Part 1. Defining Transnational Motherhood. Guilford College sociology professor Maria Madhu defines transnational motherhood as:
transnational motherhood is a phenomenon that refers or that describes the situation of immigrant women who have to travel, outside of the country, to have to cross borders in order to get a job that allows them to sustain their families, and have to leave, are required because of their immigration status or because of different reasons, to leave their children behind. That is, to leave their children in their country of origin.
This is a phenomenon that most people probably don't really know about, and when they do know, there are a lot of questions that no one really considers to ask. A big question is, how does this separation affect the mental health of transnational mothers?
So the effect that it has on the women is very traumatic. The fear, the nostalgia, the loneliness, the isolation, and the guilt. The guilt is very prominent.
Around 4.4% of the world's population experiences depression. That's about 300 million. It's hard to picture what that really looks like, but 300 million looks like the total populations of the UK, France, Spain, Germany, Portugal, and Australia combined. In this podcast, we're focusing on Central American transnational mothers. It's important to specify that to you, because in this case, most Latina mothers are often socialized to have motherhood be their main responsibility. Culturally, the mother's role is to be with the kids. Dr. Cecilia Quinn at Loyola University of Chicago conducted a study in 2017 where she spoke to women who had immigrated from Central America to the US about why they immigrated, their journey, and what life was like when they settled into the United States. One participant, Paola, left her country because of life-threatening domestic violence and has her mother looking after her 4 children. Guilford College student Karen Sosa translates from Spanish what Paola said in the study.
Pues, yo puedo sufrir, pero mis hijas no pueden sufrir de hambre. Well, I can suffer, but my daughters can't suffer hunger.
After immigrating to the United States, a lot of transnational mothers end up in domestic service, which is surprisingly isolating.
They are alone in the household with an employer that may be absent for most of the day, or who, in any case, does not understand the plight of this woman.
And then, if she's in a situation where her immigration status is vulnerable, that can create not only an unequal power dynamic between her and her employer, but is also a stressor that is constant. Reasons for transnational mothers immigrating vary, but a growing reason is a lack of any economic opportunity and employment.
We are living in a world in which the disparities between what we call the global north and the global south, between developing and developed countries, are growing wider. In which sometimes those widening inequalities are the result of the incursion of corporations from the global north into the global south that leave people unemployed or make people lose their lands or otherwise their sources of survival.
Maquiladoras, for example, are an industry that is not declining in the foreseeable future. These are factories from big businesses, such as Nike, that open in Central American countries. Maquiladoras are a result of industrialization from the global north to the global south, and will often drive out local businesses, leaving their factories as the only job option. Because of cultural norms that make it easy to exploit women, maquiladoras target them for their employees. It's a low-paying job with long hours and hazardous working conditions, but it's usually the only option for miles. Most U.S. Americans look at the Vietnam War as an example of the United States' efforts to stop the spread of communism in the second half of the 21st century. But at the same time, we were also doing the same thing in Central America, only this had effects that have only been amplified in the 21st century. The United States interfered and funded certain groups during the civil wars in El Salvador and Guatemala. Both of these wars are credited to causing a lot of human rights abuses towards civilians. And even after they ended, the unstable government and economy gave entrance to violence and employment limitations like maquiladoras. Gang violence is usually prevalent enough that 1 out of 4 children who immigrated from Central America reported losing their fathers to a violent death. It goes without saying that trauma is often unavoidable.
I mean, it's a lot of things that this woman has to deal with, in addition to being far from the kids.
Part 2. A journey through trauma. Women who immigrate from Central America usually have experienced trauma before they even reach the United States. The Diagnostic Statistical Manual says that trauma is experiencing, witnessing, or learning about a perceived threat to one's life or physical integrity. It's important to take a step back and look at potentially traumatic events Latina immigrants may have had before even reaching the United States, because there's a lot to unpack. Everyone knows that it's harder to make it through the day when you haven't had a lot of sleep. Your body feels groggy, it's hard to focus, you may be short-tempered, and everything just feels like a lot. Hypervigilance. It's the body's way of staying prepared for action and causes a lot of sleep disturbances. It can cause people to have a lot of those groggy days. Hypervigilance is also one of the main symptoms doctors look at when diagnosing post-traumatic stress disorder. A 2007 study found that half of Central American participants showed PTSD-related symptoms. Sadly, this doesn't come as a huge shock. The threat of rape has a high level of prevalence in Central America. Rape, violence, domestic abuse, and lack of economic opportunity are the top 4 reasons cited for Latina women's decision to immigrate. The journey to the United States also poses similar threats, which is another reason behind transnational motherhood. Mothers wanting to protect their children from what may happen during travel.
They have to pay a lot of money to the guides or coyotes, as they are called, and many of them, abuse of the immigrants and particularly of the women.
Maria has heard statistics that 1 out of every 4 women who cross the border are victims of rape. One woman in Dr. Quinn's study noted that some of the rape can be a result of forced prostitution from when women don't have enough money to pay their guides. Because, as one woman said, if they didn't,
Las dejan botadas. They leave them, or literally, they throw them out.
rape is one of the primary causes of PTSD. And for transnational mothers who experience sexual violence prior to crossing the border, it's especially troubling. PTSD has been shown to bring emotions to extremes by feeling too much or feeling too little. So for transnational mothers suffering from PTSD, the loneliness and isolation, the guilt and displacement is made even worse. Part 3. Access to healthcare.
De mis 3 hermanas, todas hemos necesitado terapia. Of my 3 sisters, we have all needed therapy.
Access to healthcare for immigrant women in the United States is tricky to navigate. Mental health services are even more complicated. A lot of it depends on immigration status. The fear of deportation can hold people back from seeking treatment.
The most accessible services in terms of mental health or any other, service related to their personal needs are the ones that they find through non-governmental organizations working with immigrants. In many instances are churches, particularly in areas that are heavily populated by immigrants.
Being so far from your family and experiencing depression, anxiety, PTSD, or anything else, really in an unfamiliar environment, is scary to even think about. It's easier to picture feeling comfortable about opening up somewhere familiar, like church, rather than a plastic chair in a waiting room. If a transnational mother doesn't have a support network in the United States, she might not even know about services that may be available, or her legal rights in seeking healthcare. Legally, healthcare providers shouldn't be asking about a patient's immigration status, and the patients don't have to provide them with it. You don't have to give a social security number, and there are privacy protection laws in place when applying for health insurance. That includes the Affordable Care Act Marketplace and Medicaid. What is possibly most important is someone to translate between the patient's native language and the healthcare provider. According to the National Immigration Center, everyone has a right to an interpreter when applying for health insurance or seeking healthcare at no cost. Having a translator can help to decrease the feeling of powerlessness, making sure that the patient is able to communicate with their healthcare provider and protect their own privacy. But then again, if there is no one to tell you that these services and rights are available, how can anyone use them? That's a big problem. Human connection is important, and the bond that mothers and children hold in their hugs are powerful. Thinking back to the Pandora advertisement, yeah, technology like Skype and WhatsApp do give a sort of relief, but it's not the same thing as a hug. Especially when there's already an emotional toll caused by separation, anxiety over deportation and employment, dealing with trauma, and being in the dark about where to get help. Bringing attention to the phenomenon of transnational motherhood and making it more aware to the public may be able to help. Distributing informational materials in different languages to local immigration groups on healthcare in your area can help your neighbors find help. On a larger scale, we can advocate for more free clinics and lobby against policies and laws that further restrict access to healthcare. You can look up what your government representative's stances on mental health care are and contact them to let them know there needs to be more focus on access to healthcare for undocumented immigrants. You can find out who your government representatives are and how to contact them at commoncause.org. And information on bills your government representatives have sponsored, their ratings from civil rights groups, and their records on legislation at govtrack.us. It may be hard to do something as just ourselves to tackle why transnational mothers immigrate in the first place, but we can do something to help the women who are here now. This podcast was produced by Savannah Henry for the Spring 2021 Global Health class at Guilford College. The Spanish quotes and their English translation from Dr. Quinn's study were read by Guilford College student Karen Sosa.